Walsh. I'm an Emeritus Professor here at the University of Queensland, and I hold an Adjunct title at Griffith University, and I have a part-time position as the Chief Dental Officer at Dentroid Technologies, which is based in Canberra. I carry a couple of other hats as well. I serve on some committees of the Dental Association, and I'm the current President of the Australian Society for Laser Dentistry. After graduating as a general dentist, I worked part-time in practice and did a PhD, and after that decided I should leave Australia and go to the US. So I spent some time in the US as a postdoc working in a medical school, and this was really quite a transformational experience for me to get outside the envelope of dentistry, and it was there that I began to really seriously learn about photobiology and developed quite a strong interest in lasers. So when I returned to Australia, I then decided to pursue lasers in dentistry as an important theme, and that eventually turned into setting up a group and doing some research projects and using lasers in clinic from the early 90s, then all the way through to the present time. So it's been one of the big changes in my career, was to get a different lens on a field, and that was why I think it was a really good thing to spend time outside of dentistry. And later in my career, I came back and spent some time working closely with the School of Physics at UQ, and again, seeing the world of dentistry through that lens was very useful for me. A lot of my research has been focused around what you would call molecules and materials that connect to clinical practice. So I've been trying to use lasers, microbiology, and different sorts of dental materials in various combinations to try to solve some of the problems that I run into in clinical practice. How to manage people with anxiety, how to manage people with severe decay or teeth that are eroding because of acids. A lot of the solutions that I've come up with from research have been basically directly fed by the clinical problems that I just see, first as a general dentist, and then later when I became a specialist, what I see as a specialist. One of the big drivers of my life is this desire to help people and to just try to make the world a better place than it was when I originally came into it. And in many places I've seen that there are technology solutions for problems, and there's a journey that you have to follow to take those things from a concept into a reality that people can actually use in the clinic. So in my career, I've tried to work across different parts of that spectrum of translation, from early things like clinical trials and lab studies through to things like changing policies and changing item schedules and trying to put enablers in to help people adopt technologies into their practice. Outside of dentistry, one of my great passions is anything to do with aircraft and flying. And for a couple of medical reasons, I've not been able to pursue a career flying, but I've got into flight simulation. And this provides a way of me to experience that which I can't otherwise do, and also to test out a couple of interesting and really challenging problems, and to challenge myself to continue to grow and to do difficult things, because building simulators is fairly technically challenging, and that keeps me occupied and at home during my years of retirement.